Now, mental health has been described as the hidden pandemic gripping Australia. Suicide, the leading cause of death among those 18 to 44 years old. The federal government is investing $2.3 billion to improve access to quality care. The package in the budget includes access to 3 months of follow-up for anyone who has attempted to take their life, 40 new mental health centres and cheaper access to therapies for those who find medication isn't improving their mental health. David Coleman joins me now. He's the Minister for Mental Health and Suicide Prevention. And Minister, having a minister with that title itself, I think, says a lot. $2.3 billion is a lot of money.
It is. In
many ways in this sector, billions of dollars is never going to be enough. But what is the end game here? The system's never going to be perfect. What's the utopia?
Yeah, well, as you say, Laura, it's a very significant investment, and this is about significant structural reform of our mental health system. We need a mental health system that's more joined up, that works together, that enables people to navigate through it more easily, and that importantly has the services there, so when they need help, they get it. So one of the big initiatives in this budget is $820 million to establish a network of centres that will be there to provide mental health support for kids, for adults, and a significantly expanded headspace as well. And there's a range of other initiatives in terms of early intervention and prevention, making sure we get the workforce that we need to actually fill all these roles, and a phone service that people will be able to access that will help them to navigate through the system and know where to go to get help.
In the end, do we need to see mental health centres as prevalent as GP clinics?
Well, we need to ensure that many more Australians get help when they need it than is the case today, because the truth is there are significant gaps in the mental health system today. The Prime Minister is very passionate about this issue. He's created this role that I'm doing because he wants to ensure we have an absolute laser-like focus on these issues. And the budget is very good evidence of the commitment of the government. You know, one of the things we're doing, as you mentioned in the intro, we're putting $159 million down so that Australians who are discharged from hospital after a suicide attempt get that follow-up care in the community. Now, today, only about half of people in that situation get follow-up care. We think it should be every Australian. We want to work with the states to make sure that happens, and that's why we're investing so heavily in it. That's
great, but this also tells me that you're making a serious attempt on your life and then you start getting serious care. There needs to be more prevention.
Well,
is there anything before that gap?
Yeah, it's a very fair point, and it's a really big theme of the Productivity Commission report and also Christine Morgan, the National Suicide Prevention Advisors report. And we're doing a lot in this budget in prevention. So we're going to create a world-class digital platform so that for a lot of people, if they can get help through a digital environment, that's going to be the most simple and easy to use system for them. So that'll have information about services that are available. You'll be able to get non-clinical support and also clinical support all within that one digital environment. We're also putting more than $40 million into perinatal health checks because, you know, mental health issues do often arise around that time, and can, if you can identify those issues early, that's much better than you know, down the track when they can become even more significant. So we want to work with the states on that.
How willing is the government to be when I should say, when it comes to experimental therapies? And there's a lot of talk about psychedelics at the moment. I mean, are you philosophically opposed to that? Do you have concerns about it?
No, I am philosophically in favour of anything that works and is safe. So we announced a month ago $15 million for research into psychedelics because the evidence base has grown a lot there in recent years. There's been a lot of work done, particularly in the US. Not yet approved by the TGA in Australia, but we are putting $15 million in for further research trials. And should the TGA ultimately decide that those drugs are appropriate and safe for use, then that's what will happen. Because, you know, antidepressants and other medications, they work for some people, but they don't work for everyone. And we've got to put our best foot forward and think broadly in this area. We've got in the budget $298 million for a therapy called TMS, which is a new form of therapy that's, again, had very, very good results, and we'll be investing in that now.
One thing that really struck me yesterday when I spoke to John Brogden, and I speak to him a lot about the number of calls to Lifeline, particularly through COVID, and the attitude has changed. I think people, over the last year, one of the good things is that people are reaching out for help, but we've got to make sure that when those people reach out, those calls are answered. Are you confident? And I'm not just talking about literally Lifeline, but if people do ask for help, are they getting it?
Well, there needs to be more investment to continue to make that happen. So Lifeline's got, increased support in this budget, increased support for Beyond Blue, Reach Out, which does great work with young people, investing in that digital platform that's going to help so many people, and $800 million into these centres, which is going to mean on the ground, thousands more people are going to get the care they need, and that's as it should be.
Were you aware that 200 to 400 calls a day to Lifeline are still those that were affected by bushfires?
Yeah, I saw John's comment on that yesterday, and it shows that the impact of natural disasters is devastating. It goes on, long after the event has happened, and that's why services like Lifeline are so important, and why we continue to invest and support them. The point you made about people reaching out for support is a really important one. The truth is that we're much more comfortable as a society doing that than we were probably 10 or 20 years ago, and that's a really good thing. And what we're doing this year is ensuring that the mental health and suicide prevention system is built for as best as it can be to help those people when they come forward.
We can't just look at mental health support in a silo either. Like, I look at this bushfire situation and think, a year on, people are really struggling.
Yeah.
But as part of the problem is that their communities haven't been constructed. The government hasn't got the money out the door to fix these communities yet. Surely that compounds the issue.
Well, again, in the budget, very significant investment in local initiatives to help communities. So $61 million for suicide prevention activities on the ground, including in affected communities that have been affected by natural disasters and other things. And a lot of it is about that early intervention and prevention. The digital platform.
But what I'm talking about is physical construction of their homes and their communities and getting them back. I mean, surely that's part of the problem here as well, that a year on, people haven't got their homes back. They're still living in caravans. They're still waiting for that money that was allocated in last year's budget.
Well, and obviously from a mental health perspective, what we need to do is make sure there's support for those people, and we're doing that through investments we've done today. We've put almost $500 million into programs related to COVID and bushfires, and now through the very substantial investments we're making in this budget, there'll be more of those services. Importantly, we're going to work more and more closely with the states. So by November of this year, National Cabinet has asked for an agreement between the Commonwealth and the states. I'm very optimistic about getting that agreement with the states. And so 2021 really should be a landmark year for mental health reform in Australia. We've put our cards on the table very much in the budget. We're seeing Victoria making very positive statements about the need for reform in mental health, and I'm sure all the other states and territories will do similar things.
Okay, David Coleman, thanks so much.
Thanks, Laura.
And if you or anyone you know is feeling distressed, you can call Lifeline 13 11 14 or visit lifeline.org.au for more support.